When I was interested in critical care, I wanted to get the best training that I possibly could. You're challenged, all of your beliefs are challenged about how you currently take care of people. Wherever it is that you choose to get your education, it has to be a place that you're going to be able to refer back to and be proud that you went. Students who have left BMCC can 100% say they were encouraged to excel and they were encouraged to be the best EMS clinician that they could be. Among us, we're an impressive group of people, and we do things that are not otherwise possible. For the next generation, everyone today needs to invest in their education. And as we evolve, we can be at the forefront. We can lead this change. Mentorship is important, linking yourself up with people that make you feel good about what you're doing. Don't leave yourself last. You're worth your own time. Give yourself the grace to be successful. Hi, I'm Jacob Stebel. I'm an instructor at BMCC. Currently, I have certifications as a critical care paramedic, a flight paramedic, and a certified neonatal and pediatric transport paramedic. I loved the excitement from the get-go. I was in high school when I started my EMT course, and I completed it just after my 18th birthday. And I knew that that was something that I wanted to do from the moment that I started hearing ambulances rumble outside my house. And I completed my EMT course. I left for college, and then I continued following graduation by working inside the hospital. I had a number of different roles at institutions in New York. And I knew that after I got to a certain point, I was ready to come back to EMS. I didn't know that I would come back to EMS, but there was a point where I was continuing to work inside and I knew that I missed it. I missed the patient contact and I missed the ability to directly impact patients. The gap between EMT and paramedic for me was large. I was an EMT going into college. I worked as an EMT and it was extremely beneficial for me to have my EMT during that time. I was able to use that as a profession in college. I was able to continue working, make money to help pay for school, and participate in sports and our athletic program in a way that some of my colleagues were not able to because I could offer my services and help to them. After I graduated and I came back to working inside the hospital, I didn't think that I had time to become a paramedic. So when I finally rotated back to pre-hospital care full time, I knew that I was interested in working as an EMT, and then I always wanted more. So I became a paramedic. I went to paramedic school, continued working, and then after I was a paramedic for several years, I knew that I was capable of doing more. And there's more out there, and there were our sickest patients that I wasn't able to adequately care for. And I knew for myself that I only wanted to be in a place where I had a unique set of skills and I was able to contribute to helping people in a way that not everyone could. So I think EMS is a really, really unique group of people. Although a lot of the public might not know the difference between EMT, EMS, paramedic, critical care, I think among us, we're an impressive group of people and we do things that are not otherwise possible. And without our care and without our ability to project the care that patients receive in a hospital to environments that are almost unimaginable for some people that we speak to, I think the public would be less well off. And most people who are in EMS don't necessarily give ourselves enough credit. I think we're taught to downplay our successes and we're taught to kind of gloss over our specialization. I'm not implying that we should all be braggadocious, but I think it's really important that we celebrate our wins. And part of that is being able to explain to others the type of work that we do, and for the public to know, and even for our colleagues within healthcare, to be honest, to better understand the type of work that we do. One way to do that is to have sort of this analogous conversation. There's healthcare fields that more people understand, like, oh, you're a doctor, or oh, you're a nurse, just as two examples. Being able to share that providing critical care is analogous, not the same, but analogous to ICU level care. Or being a paramedic, you might be able to provide the first 10 minutes of care you would receive in an emergency department. I think those types of analogies are helpful for people to understand. Skills that are important to be a critical care paramedic, I think, include a very particular attention to detail, more patience and time than we might usually spend on a 911 response, a commitment to lifelong learning. I use all of my resources after every single assignment, and overall, this confidence that you have to build that you're able to be here and I'm able to learn from every single assignment. There's really no room at this point where you can ever say like, okay, I got this. I've done this a million times. I don't feel as though I'm ever comfortable doing every single assignment because everything has some bit of new information that I can use. Part of this is engaging in the system that is learning. And so although we have to be humble, part of that I would encourage people to realize is we also don't know what we don't know. We're here to recognize patterns. The depth of our practice is in some places steep, but the breadth, I recognize I don't always know everything about every specialty. Some of the ways that I stay up to date are literally an app called Up to Date. It's fantastic and it's offered by some of the large healthcare institutions that I work for. If you're not affiliated, it does cost money, and so that might be prohibitive. Another way is podcasts, which are readily available and almost always free. Med Twitter and Med Instagram definitely send me ideas of things that I'm interested in looking at, but I can't necessarily just take what I have from Instagram or Twitter and implement that. But I also do a lot of research. I would say that's a hobby. Some people maybe knit, and in my free time, I participate in some large scale and some smaller scale research projects. I go to research conferences fairly regularly. And I recognize, again, that those are things that might not be available for every single person, but everyone in EMS should know that these things are out there. And I didn't know that I had these interests until I started doing it. So up to date research in terms of just getting an idea about something that you don't know and then going through your resources to be able to figure that out. That can be a physician that you know, Scholar, Google Scholar is an option, PubMed. There are resources that are available online for critical care specific transport, and even practicing or reading drug inserts for drugs that you came across or medications that you're not familiar with. I read something about almost every single assignment. The biggest message that I can send is don't stop. Like if you read something online, that doesn't necessarily mean that that's the be all end all. When I was interested in critical care, I wanted to get the best training that I possibly could. It was the most difficult college class that I took, and I wasn't even in college. You're challenged. All of your beliefs are challenged about how you currently take care of your patients, and the depth of the anatomy and physiology really opened my eyes. You can take a test based on information that you learned how to pass the test, but to really understand cardiovascular physiology in a way that you can speak about systemic vascular resistance or left ventricular end diastolic pressure. And we're talking about single ventricle hearts in kids and understanding that oxygen therapy could be harmful for some of these children. Having that sort of picture and understanding has really opened my eyes. No longer do I just say like this medication is the most appropriate. I look at this as just guidelines. So someone might say, we prefer that you use this medication, but I'm looking at it from how can I influence the physiology? How can I improve this patient's status to a place where it's more comfortable or safer for transport? When I was in EMT class, I did not understand the EMT level physical assessment. I struggled with patient assessment. And one of the things that really helped me figure out patient assessment was doing it. Very early on in my career started, I was doing interfacility transport. There were patients that I truly didn't understand what was going on. And I remember cases where my partner, this was many years ago, but my partner would kind of say like, "Oh, you do it." But like, that's not helpful to someone that isn't comfortable or doesn't know what it is that they're supposed to be doing. So mentorship is important, linking yourself up with people that make you feel good about what you're doing. Don't make you feel dumb about not knowing something. I can't imagine if I wasn't relentless in my search for information and my search for being successful, that every single person that I've ever interacted with has had the same opinion on things. Because I wasn't great at my physical assessment, I had to get that practice, and that practice only came from doing it. And so now I can go through a physical assessment if we're talking about a trauma assessment. Paramedics and certainly critical care paramedics are usually not the first on scene for a trauma job anymore. But after working through to ensure that I was able to follow that assessment and practice it through, that should be something that's stuck within you. So no matter how far you are along, you can look at a patient and you have a great sense of what's going on, but it's still important to consider the head and look for crepitus. It's not boring. Expose the chest and look for equal rise and fall of their chest. And continue on and do your full physical assessment. It wasn't a simple process, and I wasn't good at everything just at first. It does take relentless pursuit of trying to improve yourself. So even a few years ago, I don't think that everyone was talking about the importance of having a college degree. Our healthcare colleagues understand degree programs. Having a trade program, which is what EMS has sort of been up until now, has served us well. We had an amazing gap to fill. People don't die from STEMIs in the street anymore. Traumas get their golden hour almost unanimously, without worrying that there aren't enough paramedics or there aren't enough EMTs anywhere. But we now have to continue to evolve. And so that was a benefit to us that we were rapidly deployable. We can get training very quickly and get out there in the field and make a difference. But we have to continue to evolve now and recognize that many of our healthcare colleagues all have degrees that are at least bachelor's. They're expected, the hospital systems are expecting bachelor's degrees, and it's better for us as well. I won't say that every bachelor's degree is going to teach you skills that are 100% useful. I was a nerd. I liked my bachelor's degree, but there are certainly structures that we should all commonly understand, have goals for paramedicine and paramedics that everyone is on the same page. And as we evolve, we can be at the forefront. We can lead this change and share with people that whether it's mobile integrated health or a role as an inpatient paramedic that is currently, sort of a hotbed of development, if we're kind of coming at this just with the idea of a very short training program, and I'm out there and I know all that I need to know, I don't know that we'll be as successful as we need to be. I think for the next generation, everyone today needs to invest in their education and work at a place that will also invest in your education. We should be at institutions that want to support that, and we should put in that work and develop the next generation of EMTs, paramedics who also want to fit into that, not just get here to get a job and move on to somewhere else. Like, we really have to work on that. Working at BMCC, where I know it's a degree program, I think you start off with a benefit of you're already there. You don't have to then consider a separate degree program. The faculty at BMCC that I've worked with are all top-notch. I'm really happy to work with other people who have the same like-minded mentality and are interested in improving everyone else, ensuring that we have the next generation of people who are going to continue to teach. Coming to BMCC, I know that the standard of care is going to be rigorous, and wherever it is that you choose to get your education, it has to be a place that you're going to be able to refer back to and be proud that you went. And I would say that students who have left BMCC can 100% say that they received a comprehensive evaluation of their skills, they received education that is top-notch, they were encouraged to excel, and they were encouraged to be the best EMS clinician that they could be. This field is filled with stress. There is no assignment that's not going to have some type of stress. Long hours are stressful. Not necessarily being able to eat what you want when you want is stressful. Not having a restroom consistently available is stressful. Sitting upright in an ambulance is stressful. And we work in a region that generally doesn't work out of a station for 24-hour shifts with a bed or a couch or a fridge or a stove. An investment in yourself, I think, is the number one priority. I know that it sounds cliche to say BSI scene safety. Am I okay? Is my partner okay? Is the patient okay? But you do have to start there. Stress is prevalent. You're not going to escape having stressful situations. However, you do have a role in how you manage them. I think healthy coping habits, it is not a weakness to speak to your colleagues about having a difficult assignment. We have difficult assignments and we're not necessarily sure if we did the right thing. There are patients that don't necessarily have positive outcomes or the outcomes that we even expected. That might be speaking to your colleagues, or that might be speaking to someone who knows the patient better. That could be the physician that you hand it off to and ask, is this like a common sequel of this particular presentation? So the natural history of XYZ process. You're learning and you feel better because the unexpected and the unknown is also stressful. There are sentinel events that we go to, just assignments that are going to be seared in your mind. And it's important to talk about those. There's no sense in keeping it to yourself. We actually all have these similar feelings, just not everyone talks about it. We're in a field that sometimes engages in dark humor, but joking with your friends is one way to blow off steam, but there is a line where I think that you have to look out for your colleagues. And I'd like to say I'm always here. If anyone, might be odd to say, but even anyone who feels comfortable calling me here, my ear is always open. I don't have all the answers. But together we can find an answer, either to the clinical issue or you just have other stressors at home, like, oh my goodness, like I'm going to be late again. Jobs are stressful. We're caring for other people. We have lives in our hands. And so I think knowing that you will find stress is the first level. You're not weird, you're not odd, you're not the only single person. Trying to establish healthy coping habits. I'm not going to send every single person to the gym, but physical activity at least, whether that's walking, running, Central Park, or even a museum, whatever it is that you feel is necessary to sort of blow off steam in a healthy way, get your heart rate up. Limiting unhealthy coping habits, that might seem so cliche, but it's just biologically true. Intake of too much caffeine, no one can really be calm that way. Overuse of substances, and in particular alcohol, I think we do as a social gathering, but there certainly are times where I think we've all met someone who might, have had a few too many because they had a stressful job. PTSD literature doesn't suggest that that's the most productive way of like helping that memories. One way that I've coped is also knowledge, and I think that has improved me. It doesn't apply to everyone, but knowing like, oh man, okay, like next time that potassium should be above 3.5, just as a random example. Like, okay, so I'm good. I feel better now. Everyone has a life and work, but having a structure, I feel like has helped too. Don't leave yourself last. Like, I think I've said this before, but you're worth your own time. Give yourself time. Don't exclude yourself from the situation and give yourself the grace to be successful. We have families, we have work. I think most paramedic instructors have told classes when they first start, like, anticipate that this is going to be difficult. You might not have the same time with your family. You may miss special events. It's worth it and understand what you're going into, but giving yourself the grace to know that you do have to block out time to study. It's important to have blocks of time that exist just to improve yourself. We're all going through a period of education throughout our entire career, but yourself isn't last. I don't have time to study. I had to get to work. You are important. You do have to leave yourself some time. So block out time for your own health and growth. Something that I'd like to share with everyone is that patients have a continuum of illness. Humans have a continuum of wellness just the same. As much as we can influence ourselves and how healthy we are, we can't affect where we meet our patients. And some of the patients that we meet are along their disease pathway at a point where we might not have the largest impact, even with advanced skills on all of the different things that I can bring as a critical care paramedic, bringing someone from an ICU to an ICU. It's possible that we've met them too far along the way. So despite our best efforts, we might not see the outcome that we were hoping for. And that applies to EMTs, paramedics, critical care paramedics, physicians. It's something that I'd like to say because I've heard a lot of students share with me that, oh man, if I only did so and so faster. There are patients who will have fantastic outcomes and were able to intervene in time. But just because the patient had a poor outcome, please don't let that weigh on your shoulders as though it is something that you did every single time. Some patients, you meet them, you got there as soon as possible, you had all of the skills, you had all of the training, and you brought all of your equipment to the bedside. All of your interventions were done top notch, and something else happened. You're still an excellent EMS clinician, despite the fact that some of your patients might not have perfect outcomes. My legacy would like to be leaving this career at some point, no time in the near future, knowing that other EMS clinicians have this yearning to learn more, have an interest in taking care of their patients and doing the best that we can for our patients. And also that I'm leaving this with people who want to take better care of themselves. And that includes education. So, getting a bachelor's, a master's, a doctorate. So we're leaving the entire profession better for the next people. I think letting people know that sometimes patients are really sick and that they also have to take care of themselves and invest in themselves to leave the next generation improved. I think that I would feel very satisfied with that.